Hello, beautiful people. Welcome back to my space. Welcome back to Benita Fertility and Family Diary. So, I get this question often: why am I not getting pregnant? But I often ovulate regularly. People ask me this question. Sometimes you get the call. People say I ovulate regularly, but pregnancy have not happened. What happened? What is the cause? How does it? I don't really get the question now. If I'm speaking to you, if you're one of those people that ask this question, I want you to watch this video, listen to this video to the end. Let's iron it. There could be some underlying factors why you are not getting pregnant. Now, let's get to look at it. Let's look at blocked fallopian tube. Yes, even if you release a healthy egg every month, the sperm needs to meet the egg. You see, if one or both fallopian tubes are blocked, fertilization may not occur. That is why your doctor recommends an HSG test for you to know if the tubes are open or not. So that is why it is very, very important. You might be releasing egg every month, but if the tubes are not open, fertilization might not occur. Another second factor in my list is male fertility, male factor fertility. Yes, pregnancy depends on both partners, not just on the woman alone. A woman may be ovulating normally, but if there is issue with the sperm count of your spouse, the sperm movement, the sperm shape, conception will be difficult. Yes, this is why semen analysis is often important in fertility tests, in fertility investigations. Semen analysis is very, very important. Now, another thing we have to talk about is poor egg quality. You may be ovulating regularly, but the quality of the egg release also matters. Yes, if you have a very poor quality egg, fertilization might not occur. You know, as the woman grow older, the quality of the egg naturally declines, so which can affect fertility and the embryo development. So it is important. That is where AMH test, anti-Mullerian, to know the quality of the egg comes in. Another thing is timing of intercourse. You might be ovulating regularly, but you have a poor timing of intercourse. You don't time your intercourse very well. I've heard many persons say ovulation is on the 14th day. No, it's not everybody. Remember, if you don't have a 28-day cycle length, I might even say some persons don't even know what is cycle length. For you to time your intercourse very well, you have to know how to calculate your cycle length. For you to time your intercourse, you have to know how to calculate a cycle length. If you have a 28 days, if you have a 26 days, 27 days, or whichever. And your cycle length is from the day your period started till the next time you're going to see the period again. The number of days is your cycle length, you see. So from that cycle length, you'll be able to calculate your fertile window, your peak days, and all that. So if you are ovulating and you are not calculating it well, you might not be able to time your intercourse, and if you don't time it, pregnancy might not happen. Now, another thing is hormonal imbalance. Even if ovulation occurs, hormones such as progesterone, prolactin, and thyroid hormones can affect fertility. Hormonal imbalance may interfere with implantation and early pregnancy. So it is important, if you're also trying to conceive, you work on your hormones regularly. Number 6 is problem with the uterus. Conditions such as fibroid, polyps, or abnormalities in the uterus can affect implantation. In this situation, the fertilized egg may struggle to reach the uterine lining, you see. So this one too is another problem. 7 is endometritis. Endometritis can affect fertility by causing inflammation, scarring, and damage to the reproductive organ. Some women with endometritis still ovulate regularly, but may experience difficulty in conceiving. Now, we still have an unexplained fertility problem. Sometimes all fertility tests may appear normal, yet pregnancy does not happen. This one now is in the hand of God. This is known as unexplained fertility problem. Do you know, we cannot, even doctors cannot explain this. That's when they will be like, everything is fine, but it is not. This one is in the hand of God. It can be frustrating, but many couples with unexplained fertility eventually achieve pregnancy with the right support and treatment. Some couples with this, the right support I'm talking about, that is where you have to cleave to your God. That God, you know, I don't know your own God though, but I know my own God. So you have to cleave to that your God for this unexplained fertility problem. So when will you seek help? If you're under 35 years old and have been trying for 12 months without success, consider seeing a fertility specialist. Very, very important. If you are 35 years or older, seek help after 6 months of trying. Some persons at 35, they'll be like, they've tried for 5 years. That is making them 40. And they are still, some are taking one, some are just cutting short. You don't need to seek a fertility specialist. Do you understand me? And you see yourself achieving results. My trying to conceive mama, if you are ovulating regularly but not getting pregnant, please do not blame yourself. Ovulation is not only piece of the fertility puzzle. Do you understand? A complete fertility evaluation can help identify the root cause and guide to the next step. Please, I don't want you to give up. Your miracle. Stay hopeful. I don't want you to give up. Your miracle is on the way. I don't actually want you to give up. Stay hopeful. I want you to stay hopeful. I want you to keep hope alive. Your miracle is on the way. If you find this video helpful, I want you to subscribe to my YouTube channel, and please follow my page on Facebook, Benita Fertility and Family Diary, for more of your fertility talks. Thank you so much. Bye-bye.